everybody. We are coming to you live from Sleepy Dog Veterinary in Arlington, Massachusetts. I'm going to just raise my hand as I'm speaking because you can't really tell. I'm Beth Innes, and I'm the doctor and owner of the clinic. And this is
Nurse Sam,
who is my right-hand lady. And this is Miss Bowie, who's feeling slightly shy, so she's facing somewhat back in the back area there. So feel free to ask us any questions. I'm just making sure that we can see them. They'll come up for us, right?
yes.
Okay. All right. And we're just going to give you a couple of updates on the clinic and what's been going on lately. And then if we have time, we'll do a little demonstration on Miss Bobo here. She is sitting on one of our pulse electromagnetic field pads, which she does appreciate, which we've been using for almost all of our treatments here lately. So, one interesting update that we have that is coming up this, Mish, what would you say, May, June? We'll have our new software system, probably June. The optimistic Sagittarius says May, but the realistic Aquarius says June. So we're getting a new software system which will be helpful when it comes to managing our records, which is important if a little boring. But it will also most likely come with the capability of doing some of your own scheduling, so being able to use that. And we'll also have a portal where people can access their records for things like insurance claims, which we certainly have a lot of clients that use for our patients. And also, I really like patients and clients to have copies of their lab work and imaging, so that if ever anything comes up and they have to go to a specialist or an emergency, heaven forbid, then they have all that information with, kind of have access to that at all times, so things don't have to be repeated. So that's exciting. It's called eVet. I don't know that things might look a little different in terms of invoices and emails. But hopefully it will help us be a little bit more efficient and have more things to offer. Let's see, I see a question. When do you anticipate accepting new clients? Good question. I am not sure yet. One of the other updates that we were going to talk about was going to be with the new COVID regulations from the CDC, things are changing a little bit in our world for the better, which is great. But we will continue to be curbside until we find a safe way to reopen the clinic, and that's part of what is limiting our new client admissions. We do have a waiting list, however, so if that is something that you are interested in getting on, we're happy to have you on that. And Dr. Bramhall at this point is still accepting new clients. It just takes a little bit of time, I would say. But certainly keep at us so that we can make sure that we get you in as soon as possible. Okay, and as you may or may not know, Mish, who is often behind the scenes, in fact, she is literally behind the computer right now. She has been with us this month, so we have been thrilled, and she will be going back to her home in DC, but still with us virtually. So you'll still hear from her and know that she is keeping us to task here in Arlington from DC, our nation's capital. All right. And Lynn, who is Misha's sister, has been helping us on the phones and email this month, which has been wonderful. So we've enjoyed having her here as well. She also lives in DC, so we will call that area of our practice Sleepy Dog DC versus Sleepy Dog Boston, Arlington, Sleepy Dog Arlington. Okay. The other things that are going to change a little bit is in May, which is next week, we're going to tweak our schedule a little bit. We're always trying to figure out our maximum ability to see everyone. So our new schedule is going to be Monday through Friday, 10 till 6. That seems like crazy hours, but it seems to be the hours that most of our clients are gunning to get in. So we're going to give that a go. What that will also help us do is we'll have we'll be able to have Nurse Sam with me all the time, which is excellent. And also we'll be able to do all of our procedures during all of our open hours, whereas previously we were a little bit limited. Oh my gosh, my notes keep going down.
Just make sure there's not any other questions.
Oh yes.
Doesn't look like it.
We're good. All right. Let's see. So new schedule starting in May 10 to 6. As always, you can email us off hours. We just can't always get back to you until our open hours. Let's see. Yes, so the COVID guidelines are changing right now. As some of you know, we are doing curbside care. So that includes you come, you call us, we come out to your car, or we meet you on the sidewalk now that it's nice out, and we get all of your information previous to our visit through our questionnaire via email. And then we take your pet and we bring them in the clinic, do all of our treatments, and give you a call and come up with a plan. We always wear masks. Not all of us on our team are yet fully vaccinated. We're all on our way, but it's not safe for us yet to have everyone in the building. We also have changed our clinic quite a bit over COVID to accommodate for curbside care. So we're going to have to strategize how we're going to be able to make that back into the clinic that we had before, or most likely some other version of it. Any tidbits that you'd like to add, Nurse Sam?
I don't think so.
Okay.
Yeah.
All right. Another kind of update that we have on our whole program of individualized integrative care. I think that's going pretty well.
It's going amazing, actually.
So this is really helpful when it comes to taking care of the whole pet under our roof. With COVID, we've had to do some adjustments to make it so that patients are not having to go out multiple times. As you guys may or may not know, we do a lot of palliative care and care of chronic diseases, managing all different kinds of things. Let me give some examples. I would say arthritis, back pain, neck pain of a chronic nature, bowel disease, whether it's constipation or IBD, chronic colitis, that type of thing. We see a lot of skin issues. We see a lot of food allergies and food intolerances. Anything that an animal, or for that matter a person, can get, but we treat the animals. Anything that requires like a long-term plan and tweaking that plan over time, we tend to manage. And so we are continuing to do that. We're using a lot of our laboratory machines, different laboratories that do some different bells and whistles so that we can measure things like the body's magnesium or vitamin D, looking at the amazing but organ system of the microbiome. We do a lot of testing for that. And so we're able to incorporate that into some more of the general care. Lots of kidney disease, lots of cancer, which is really crummy, and yet a lot of our pets can live with it really harmoniously for longer than we think. Any other things that you can think of, Sue?
Those are my main ones.
Yeah. All right.
And I'm just excited about all the new tests we have.
Yeah. There's some really good ones. I think we're learning too more and more. The more that we run some of these new tests, the more we can use them effectively, which is really great. And then I would say, so we are having a good time and with good success using all our Western and more conventional medicine, but adding it with things like our pulsed electromagnetic therapy. Bowie just got a chiropractic adjustment. Also using our acupuncture. Sam does her massage. Also incorporating craniosacral therapy, which she did a Facebook Live on last month.
Yeah.
That was a month ago. And then also doing acupressure, nutrition counseling. What else? Gosh. Cold laser therapy, herbal medicine, Next year, I will be learning Western herbal medicine. Most of the herbs that we use at the moment are Chinese medicine based, but we are tinkering with some more Western herbals, which will be great. Um, Sam said one of her most frequent questions lately was flea and tick prevention. We can touch on that. We in New England have such a problem with tick-borne illness that we are pretty paranoid about it, because of people in our lives, and also pets being affected by Lyme disease, anaplasmosis, sometimes even Rocky Mountain spotted fever, or lichiosis are the big ones. And so we are pretty careful and have not found a, Kathy reminds me, also physical therapy and rehabilitation. How could I forget? I forgot because right now in the building, Kathy and Chris are not here, but on Saturdays, the fantastic Kathy, PT rehab extraordinaire, is here seeing patients, which is awesome. And Chris Cranston, who does a very similar thing, but in a very different way, is here in the evenings and sometimes on Sundays as well.
Yes, and they're even seeing cats, which
That's
is
right.
so great.
Yes. And if you can convince a cat to do a therapeutic exercise, then you are pretty much the cat's meow, I would say. Am I right? Oh, Mish just crumbled. That was a bad joke. All right. And let's see. So flea and tick stuff. Yes. So we have actually been using a lot of the conventional treatments because we have found that that is the most effective, but it certainly depends on what your pet's level of risk is. If your pet is mostly in the city and mostly an indwelling animal, we worry a lot less and we don't have to take out the big guns. If your pet is someone who goes to New Hampshire often on the weekend hiking, or up into the fields where the deer have been, then we're going to be a little bit more aggressive, shall we say, about our flea and tick prevention. So we have used some of the by-mouth products like Bravecto. I would say, despite all of the tricky stuff that's been happening with Seresto, some of our clients really do have a great experience with that. I think that's what Bowie uses, right?
She uses
She uses Bravecto now. So we carefully monitor our patients and we do our best to kind of weigh the pros and cons of what is going to be best for them. There are some natural products out there. We find that if they are really in the woods, they're not always as effective and they require a lot of like very careful compliance by us, the humans. So my favorite one would be by Vetri Science, Vetri Repel, and that comes as a wipe. They might also still have it as a spray.
There's also a spray.
There is, okay. And that I think is great as long as you use it once a day. It's labeled, I think, once every day to 3 days. But you have to use it really regularly. Some people like the smell, some people do not like the smell. It's very herby smelling. And I think that it is not 100% like anything, but it requires also daily, if not more than daily, tick checks as well, as all of the products should have. But I think that you have to be very cognizant of how much you feel like you can be really on the ball and weigh, like I said, the pros and cons of the disease that an animal can get from being exposed to ticks that are carrying diseases and the risks of using the product. So that's a big topic, and it is not something that is, there's not one right answer. It just depends on the situation, the person, and the pet. All right. Mish, can you think of any questions that you get asked frequently? She says no. When are we going to see new patients? When are we going to be able to let people in the building? What is the best flea and tick control? Do we do vaccines? Yes, we do vaccines as necessary. We try to minimize them, but we do them to abide by the law and risks of our animals. We also do a lot of vaccine titers, which I believe we've talked about in previous Facebook Lives if you have caught them before. A titer is measuring the level of antibodies in the blood to see if an animal or a person is protected against the disease in question. So when you think of COVID-19, you can do a COVID-19 titer, and then you can measure your level of expected protection. And with dogs and cats, our most common titers would be distemper and parvo for dogs, and Kalichi virus and feline distemper for cats. And we can do all of those here. There's also rabies titers, but that is much more of a question of whether it is accepted by the municipality that you live in. I almost said state, Mish, but keeping in mind, DC is not a state yet. Soon. I think that's about it. I was gonna do maybe a little bit of a acupuncture demonstration on Bowie, but I feel like she's too sleepy. So why don't you help us with an acupressure demonstration? So I'll give you. Can I divulge some of her medical things? Okay, so this is Sam's dog Bowie. I just gave her a chiropractic adjustment for a sore neck. She has a huge head. Will you turn on the map again, please, Sam?
Yep.
Look at how big that head is. So, in carrying around that huge, beautiful head, she is often sporting a sore neck. She also is not gentle with her body, and as Sam likes to say, she's a sport mode Frenchie, and so she often has a lot of concussive forces. I'm just going to tip this tiny bit so you can see her head. So let's say, so I mostly worked up here with my adjustment, which I should have waited for this video, but I didn't. And Sam has noticed that recently she's been a little bit tender down here, which when we think of the way that the spine unfolds at birth kind of makes sense. But so tell me where and how you would like to acupressure her, pretending that she's not your own.
Well, my first thought is to actually do a quick kind of craniosacral release, and she was so uptight up in her atlas. So I'm quickly just going to go on either side of her spine using my fingers, supporting underneath her neck.
Her giant head. I think that's what you meant. Yeah.
She's already kind of telling me it's tender, so I'm kind of gently just going to go in. Whew. That is tight, huh? And this is subtle, but she's kind of snorting at me and moving her head around, so she is telling me that is the right spot. Not all dogs will snort in the affirmation, but a Frenchie. Depends on the breed.
Will definitely. Good girl, buttercup.
And then I always love to do bladder 10 for any kind of cervical.
Tell me where bladder
tension
10 is.
It's located. Oh. I don't know if you guys can see that. It's kind of the midpoint of her neck. Oh, there we go. Good job.
So acupressure is something that you want someone trained in?
Yes, it's on either side of her spine. So the bladder meridian goes along both sides of the spine. That's a good one, huh? So it looks very similar to craniosacral, except acupressure, you're intentionally going to different acupuncture points. Ooh,
good
stuff. Oh,
that feels good. As you can see, she's starting to lay down a little bit. She's getting a little droopier.
Good girl.
Sam does a lot of acupressure here for us. With your massage and craniosacral, but also there are some patients that have a harder time tolerating needles than others, and then it comes in really handy. Or for our patients that are we're trying to keep from having to come in as frequently, sometimes Sam will teach people to do it for their pets at home.
Yes. The other one that I like to do based off my training is bladder 23, which is the kidney point, but that can be really helpful for any bone type of tension.
Arthritis.
But yes, by bone tension, I apologize. I mean arthritis, any type of
healing fracture, maybe.
Yep. Spondylosis.
Spondylosis is like a bridging between the vertebrae. That's usually in response to a little bit of too much movement between the spinal vertebrae.
And anytime the joints get stuck or the vertebrae get stuck, I like to just stimulate this point.
As you can see, Bowie's all for it. She's now gone to dreamland.
And then I'm going to be kind of mean and ask her to sit up because my other two favorite points, unfortunately, are in the back leg.
Do you want me to hold it for you? Alright, stay.
So the first one is bladder 40, which is great for the spine, and that's located right behind her knee in the little divot right there. So I'm just going to stimulate that. And you always use 2 fingers because it's energetically neutral, or you can use your thumb.
When you say energetically neutral, expand on that, Mercy.
It means that you're not putting in technically in acupressure, you're not supposed to put any of your own energy into a point. And so when you put your fingers together, it creates a neutral energy that's put in there. You're not putting any of your own intention in there. So the animal can do, yep. And the animal can do what it needs to with its own energy that way. And that's on either side, but I'll just show you on the one leg. And then the last one, which is called bladder 60, aka the aspirin point, is located down by the hock in this little webbing here. And I like to go on either side, which technically the other side I believe is kidney 3.
That's true, and usually if you stimulate one, you stimulate the other, and that's a nice double whammy.
Yes. It can be great for any pain relief or discomfort. And she's sinking again. Okay.
Bowie likes to be a demo for some things, but
Yes.
not other things. There's definitely this type of thing.
Good job.
Are there any questions before we let everybody
And she
go?
just gave us a nice shake. I hope everyone saw that. That means that we moved what we needed to, right? Good job. All right.
All right, everybody. Well, we hope that you have a wonderful afternoon. If you have questions, please send them in to us so that we can do further little segments here from the SS Sleepy Dog. And we will look forward to seeing you soon. Thank you.